Special edition of the Rant, unedited. Yeah, my camera moves around. I got a selfie stick, okay? I know some of you sent in notices. Dutch, get a better selfie stick. Dutch, get a better this. Dutch, get better audio. These videos are for me. You don't understand. I do them because I like to pontificate to myself so that I can think. P.S. There are 4 million patients that we're not serving this month. The heck else am I doing? I mean, this morning, I'm smoking a cigar, sitting on the bridge by my house, having a cup of coffee. I'll tell you, it's better I do that, and it's better that I rant on an unedited basis and say what I really want to say. Because the amount of leadership that is lacking in this country is enormous. I mean, I had enlisted Marines that I worked with that had more leadership skills in one of their testicles than these elected officials. And certainly, don't even get me started on the hospital administrators or these folks from BlackRock or Blackstone or KKR that love their surprise billing companies. Oh, and that love their ER companies, and so they're cutting the wages of the physicians on the front lines. Hey, listen, here's what I want you to do, Marines. I want you to go to war, and then I'm going to cut your pay by 40% while you're out there getting shot at and getting dead. Good idea. You know what that is? Those are rent seekers. And the good news is the American people have allowed it to happen. Oh, yeah, you got to lay blame somewhere, don't you? Yep, well, while Twitter, Facebook, and the rest of the social media wants to blame politicians, I lay it squarely on the American people. You voted for these people. I mean, what the heck? In the late 1960s, New York was the first state to vote in certificate of need laws. Don't you think New Yorkers like more beds about right now? In 1997, the federal government capped residency slots for physicians. Think I might want some more of those. We made it illegal for physicians to own hospitals. Solid call, America. Then we instituted HIPAA, macro, micro, blah, 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 and blah, blah, blah to make healthcare better. Because physicians are bad, nurses are bad, 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 and no one knows what the hell they're doing. Leadership sucks in this country. There isn't any. But I'll tell you where you can find some. You can find some on the front lines. Go to any hospital in New York City. You can find them there. They're leading. They're getting their hands dirty, helping patients. I'll tell you where else you can find it. There are private practice physicians sitting on the sidelines today that have actively called on health systems to help them. And you know what the health systems have said? Buzz off, surgery center owners. What do you know about healthcare? Yeah. These lovely health systems that are absolute junk in the trunk, crap systems, are telling private practice physicians who put their own capital on the line to go kiss off. I didn't hear it once. I didn't hear it twice. You have to remember, I've spent my lifetime around physicians and nurses, mostly in private practice. I'd say 99% of private practice. So if I have a bias, which I do, it's towards private practice. But leadership is lacking. So we're cutting the pay of emergency room docs and nurses. We're cutting the pay of frontline workers because that's what private equity does. If you didn't know that already, that's what it does. We limit the amount of hospitals that are to be made, at least in 35 states, with the leading winner being New York. Wait till the people of New York figure out that for the better part of 40 years, we've limited the number of hospitals that are built. Wait till that happens. Wait till they figure out that their enemies are in their backyards. I mean, surprise billing doesn't come from a lawyer in Omaha. Nope. Or even, I don't know, name some backwards place. They don't come from Alabama. They don't come from, I don't know, wherever else. Iowa, Oklahoma, or Texas. All places I'm not a huge fan. I mean, I'm sure they're nice places. I just don't want to go. But surprise billing comes out of New York City, comes out of private equity. Con laws, alive and well in New York City. This is the kind of leadership we're going to have to face. So it's not some national politicians. I mean, they're at fault for a lot of things, but they're stupid. It's because we continue to put government in charge. We continue to allow lobbyists to do their thing, and we continue to allow big business. I mean, why is healthcare so expensive in America? Because Americans want to go to the hospital for everything. There are 5,000 physician-owned facilities around the country, all of which do the same non-elective and non-emergency procedures that are done, elective and non-emergency procedures that are done in hospitals. And yet American people go, I want the best care. Well, the best care isn't delivered in hospitals, dingbat. The best care is delivered outside the hospitals. I don't want to get caught up in readmission rates and infection rates. But look, if you want to pay 50 or 60% less, and go see a private practice doctor, that's where the real leadership is. Go see a nurse. That's where the real leadership is. Take your medications like you're supposed to. 66% of the population of the United States is non-compliant when it comes to the issuance of pharmacy. They don't take their pills on time. They don't take their pills. Some people sell their pills. A full 40% of people that have surgery are non-compliant. We had a guy go skateboarding last week after he got a total knee replacement. You think that was smart? No, but this is the state of America. Americans do what they want to do, and then they want everybody else to be responsible for it, instead of looking inside. Maybe we ought to consider looking at ourselves. Maybe we ought to consider asking what we're doing to cause these problems. Because there's lots of New Yorkers complaining about surprise billing. Yet the home of surprise billing is right in the heart of Manhattan. I can show you the buildings. I mean, there is surprise billing going on in Arizona. There is. One of the largest companies that does it is here in Arizona. The other 3 large companies are in the Northeast. Oh, did I just say Manhattan? Yes, they're all in Manhattan. Why do we continue to have problems in the healthcare sector? Because the government's in charge. Because big business has been in charge. Because government writes laws to help big business. See, the thing is, big business isn't nefarious. They do what's in the best interests of their shareholders and their owners. And you ought to do what's in your best interest. You're the owner of you, your own corporation. But you don't. You defer. You say, let the government handle it. See where that's gotten you? That's gotten us 10x worse on this coronavirus than it could have ever gotten us. I'm done with this rant on a Friday. I'm going to go smoke my cigar. Rojas out.